back to my YouTube channel. This is Jane, and this is the Overseas Nursing Bands. You know what we do here? Everything OSCE nursing, overseas nursing related, we banter, we talk about it, and I'm helping you with your OSCE preparation, something to refer to help with your revisions when you're doing your OSCE to become a registered nurse in the UK. So anyway, before we start, I just want to ask, how are you? How are you doing? Okay, so you're good. Yeah, welcome back. Like I said earlier, we'll be dealing with evidence-based series this season. I don't know for how long I'll do it. I'll take at least 4 to 6 topics on evidence-based and we do it, and then maybe I don't know what we'll get next to, maybe skills, or I'm not sure yet, but we will find out. Okay. So today we're going to be talking about pressure ulcer prevention rather. We know that the evidence base is a silent section station is also, so that means is writing. It is you, your pen, and your book. What usually happens in this series is that in this station is you're given a case study, a scenario, say a patient with XYZ has XYZ. Usually I would want to avoid giving a specific scenario so that you don't get confused and think, oh, but this is what Jen said. Are they showing a different thing? But I'll tell you, because the answers apply to whatever scenario you're given. You'll be given this scenario, you'll be given the summary. When you read the summary, you read the scenario, then it will help you. The answers are always the same. So we'll concentrate on what you're going to write down, no matter the scenario that comes to you when during your examination. I hope that's clear. You understood? So today, like I said earlier, it is pressure ulcer prevention. It's a silent station. It's 8 minutes. You have your pen, you have your answer sheets that you'll be given, and make sure you write your name. That's what I would do. Personal advice is write your name where you need to write your name, first of all, because when you're writing and you don't know, you get carried out away, and then you just submit without. Not too good. Yeah, so I would write my names and everything, number, whatever I need to write on my answer sheet, and after doing that, before I would start. Okay, so on starting, make sure, again, make sure that your handwriting is legible, it's clear. Don't make sure your handwriting is legible, make sure it's clear. Avoid abbreviations as much as possible. If you have to abbreviate, make sure it's universal, but if it's not, don't abbreviate your own. Avoid abbreviations, really, really important. Avoid abbreviations. So we're going to go right into this now. Yeah, like I said, it's the marking criteria that they're going to use. And what does it say? It's going to be asking you, summarize the main findings from the article summary and draw conclusions, making recommendation for practice. So you've been given this scenario, Mr. XYZ, they will give you his weight or whatever. His Mr. TJ is an 80-year-old man. He uses a catheter, or they'll just put everything, but the main thing you're looking for is this answer. And then they give you summaries. These summaries will state that this condition, people arrive at this conclusion, people arrive. So these are the evidence basis, and then based on that, you advise your patient. And advice number 1 that we'll be going for, it says that you'll be informing this patient that a specific foam preventative dressing applied to a person's sacrum has been shown to reduce pressure ulcer development by 10%. Okay, however, even with a dressing, he may still develop a pressure ulcer, although this may occur later. You write it down. That's your answer. 1, the advice you've given to this patient. 2, explain that a very rare side effect of the foam dressing is a mild skin irritation. So that's the silicone foam dressing, silicone butter foam dressing. So some people don't have reaction to it, but you have to tell them in case they fall into the category that have reactions to say, oh, you might see some mild irritation from this. Don't worry, it's nothing to worry about. Just inform us. So you explain to this patient that a very rare side effect of this foam dressing is a mild skin irritation. 3, you advise the patient that being male, he may be at more risk of developing a pressure sore. So males are at higher risk of developing pressure sore. That is what you'll be penning down as your advice to this patient from the scenario and the summary that you have been given. Is that okay? Bring on your questions. And then the next one, you say, explain to this patient that regular skin inspections, regularly changing positions, staying well hydrated, and maintaining a balanced diet will also help with the prevention of pressure ulcer. So when they turn, if they're lying down, if they change position regularly, so they don't sit in one spot, it helps. Drinking fluids help. Eating a well-balanced meal with their proteins, and other things necessary helps. And other diets that they can include, those helps. So your answer would be, again, explain to the patient that regular skin inspection, regular changing of position, staying well hydrated, and maintaining a balanced diet will also help with the prevention of pressure ulcer. Let me just break down, just say in practice, actually, it's very important to inspect, because you'll be thinking, oh, this patient is all right, is ambulating, is mobile, and then you'll be surprised because you're not seeing them regularly. They might just come into the ward. So when you inspect the skin regularly, then you will catch anything that needs to be caught. You know, so it's reddening, it's blanching, it's this, it's that, and then you can take further action to prevent. I digress. Let's go back to the answer. That's, say, inform the patient that there's a foam dressing that may aid in the prevention of a pressure ulcer, and that this will be discussed further with tissue viability team. So these will be the advices you'll be giving to this patient that you have. All right. So it's actually quite straightforward and very simple. Don't you think so? I do think so as well. I'm hoping that this has helped. As usual, if you have questions, email me, all right, or even drop it here. That's fine, doesn't matter. And I will try my best to answer to the best of my ability. And when I don't know, I'll refer you to who knows, or I'll help you research it and find out. But this is what you'll be needing for your evidence-based section, where you'll be writing for 8 minutes on yourself, a silent station. I hope this helps. Thank you for watching. I hope this helps you. Don't forget to subscribe. Don't forget to comment. And don't forget also to share to people who might need it. And yeah, so this helps you. Thank you so much for tuning in. And cheers. Bye.